I've seen firsthand the breakthroughs when AI is done right and the risks when it isn't. Welcome to week 1 of our AI summer series. This week we're talking about text generation. Hi, I'm Teresa Yunkin. I'm a healthcare informaticist and an AI strategist. I've trained executives, I've led AI pilots, and I've driven national conversations around FHIR interoperability and governance. My mission? It's to stitch people and processes together with ones and zeros. So let's dive into this week's subject. Most healthcare teams have access to AI tools, but they're stuck on the how. They don't have clear prompts, and leadership is not sure what to teach. Pilots will stall, staff grows frustrated. There becomes a fear of jobs being lost or taken over. Text generation, that is the easiest entry point because we can use it for memos, discharge summary, policy recaps, the work that your team is already doing with AI. And with the right guidance, you can turn AI from a toy into a trusted team member. Now, I want to talk about this from 2 points of view. One is from the clinical view, and one is from the patient or caregiver view. What happens in that EHR doesn't just affect the clinical enterprise, it affects the patients who have to use the information coming out of the clinical enterprise. So throughout this whole series, we're going to be talking about both the clinical side and the patient side. And the beauty of AI is that you can use the same prompts in both settings to get out what you need because of your context. I want you to be able to make AI your reliable partner. Let's talk about discharge summaries and after visit summaries. Those are those lifelines between what happened in the office or with the physician and when you get home. The thing that's hardest to overcome is that what happens in that clinical setting is written generally at 11th grade level. It's written in jargon. And when a patient gets home, there's so much going on in that clinical visit. They struggle to follow their own care plans and they struggle to understand or to reconcile what was said versus what's written. For the clinicians, it's the same problem because now you've got patients or caregivers who are calling back and who need clarifications on something that was written for the clinical enterprise, but not really for patients. And that means that clinicians are having to simplify instructions, maybe make a phone call back or push it through the patient portal. It causes a waste of time, a waste of energy, disillusion, and again, it becomes a barrier to what we used to know as the doctor-patient relationship. Now, I can tell you that in under a minute, we can fix some of this, and I can show you how to prompt AI to convert that dense clinical note into something that's readable and understandable for a patient. And patients, if your doctor's not doing that or you don't have a way for that to happen, you can do it yourself. And I'll show you how. Same prompt, same situations. All right, let's talk about a clear prompt. It's context, length and limits, examples, actions, and review. So over the next couple of minutes, I'm going to unpack each step so that your prompts, whether you're a clinician or a patient or a caregiver, hits the mark. Context. Set the scene so AI knows exactly what it's working with. For example, what you could use in the prompt is, this is an after-visit summary for a 72-year-old patient treated with IV antibiotics for pneumonia. This is a follow-up visit. You need to tell the model exactly who, what, and why. When you do that, you're going to get a tailored output. Have you ever just asked ChatGPT something and you got back this answer and you were like, that doesn't even meet or even close to what I need right now? It's because you didn't give it a context. The second thing we're going to talk about is the length and the limits. You can define the size and how you want it to give it back to you. You can tell it to limit to 150 words. That way, it's going to keep it concise, organized, and on point for you. Number 3, examples. Show AI exactly what you want. Tell it to give it to you in bullet points, in a table. You want to make sure that it is speaking to you and you're getting back the responses in a way that's easiest for you to read or easiest for your patient to understand. Number 4, action. You want to use strong verbs. Transform, rewrite, simplify. For example, transform into patient-friendly language at 6th grade level. That tells the AI exactly what to do. There's no guesswork for it. Number 5, review. Ask the model to self-check itself. You could put into your prompt a phrase like this: verify the clinical details and compare it to what was actually written. It's really important that you do this review step because that's where you're going to catch errors and that's where you can polish up your message before you share it. So where does this apply? You could do it for clinical note summaries. You could say, in the clinical setting, draft 5 bullet roundup dates for today's med-surg census. Include vitals, labs, and next steps. If you're a patient, you could say, please summarize and bullet point all of my actions when I leave the hospital. Policy clarification. On the clinical side, turn this EHR access policy into plain language and bullets for nurses. For a patient, it would be turn this privacy policy into plain language with bullets so I understand my rights. You could use it on team ops briefs. Clinical prompts. Summarize these 5 messages into a 3-point action log for our project tracker. For a patient, summarize these 3 after-visit summaries from each one of my providers, create a table, and tell me if there are any medication interactions that may happen with my new medications. Tools that you can use on both sides. Microsoft Office Copilot, it's everywhere. You can use ChatGPT, there's Claude, Perplexity. There's a whole host of tools out there that are free and paid that you can use. The secret is going to be training yourself and your people on clear, controlled prompts. As with any technology, you need to watch for the pitfalls. Because you know what? AI sounds confident, but it can be super, super wrong. 3 things to watch for when you're using prompts, when you're building them, and when you get back responses. Overconfidence. Always proofread. Never skip that review step. There could be bias and privacy risks. There could be fear and resistance. Now, this one I want to point out. When we're talking about using a tool that your team already feels ambivalent about, they're already fearful of it, you should be framing AI as a co-pilot, not a replacement, right? How do you do that? Well, you need to celebrate the small wins. When you get a prompt that's really good, share it across the team. Share stories of how people used it and share ideas and brainstorm with these prompts. Because that in itself is going to help to normalize the learning curve so people don't feel like if they don't get it the first time, they're never going to get it. So important. All right, as I promised, we're going to have a real world case study. For this one, we're going to be talking about an NYU study that was an operational pilot, and it showed how good prompting could save clinicians time. Unfortunately, we don't have a whole lot of studies support the use in patients. NYU, in this one, it's by Zaretsky et al. You can find it in JAMA on the Open Network. I'll put a link down in the description. They used GPT-4 to transform about 50 discharge summaries. With the prompt that they used, they were able to bring down the reading level from an 11th grade to a 6th grade level. Because they did that, they were able to raise the understandability scores for their patients and caregivers. That understandability score went from a 13% to 81%. 81%. That's huge when it comes to communication, right? I told you a message and you understood the message. Oh, chef's kiss perfection. Here's some more things that came out of that study. Over half of the AI drafts needed no edits. There were some omissions that came out of that study. Again, those omissions aren't a fail. They are reinforcements about how much we need humans in the loop during that review step. I encourage you to take a read through the case study. It's interesting, easy, light read. All right, next up, my top prompt power tips. These are the tricks that I use when I'm prompting AI. Number 1, I put all of my prompts into a dedicated folder. You should too. Trust me. You're going to thank yourself and your team's going to thank themselves later. Why? Because you're not opening up 18 different chats trying to remember, oh, what was the best one that I used? Or you're not going to have teammates recreating prompts and trying to get it just right. They'll have a baseline to start from. Number 2, prompts are drafts. Always remember that. After you get your first answer, refine it. You can tell it things like make it simpler or add some empathy into the voice. I generally tweak my prompts and my answers anywhere from 3 to 10 times before I share them with anyone. Tip number 3, always protect privacy and double check the facts. Remove any PII and verify any critical values that you're there. Again, you're going to have to look at what the LLM provided you and then look at what was actually in the document. Back to that tip number 3. I want to bring this to your attention because AI is constantly changing. It fluxes all the time. I don't know if you heard, but last week there was a recent court order that requires OpenAI to now retain all of the ChatGPT conversations indefinitely, even the ones that you've asked it to delete. Why is this important? That means that anything that you put into a public chat may become permanent. What does that mean? Once it's permanent, then it can be subject to legal or to regulatory requests. There is a way around this. And if you're going to be using any LLM for confidential workflows, you can use the enterprise APIs, but you need to have a zero retention agreement with it. I am just telling you the information. I would encourage you to go speak to your legal department about this. You can also self-host an open source model that you control. So something like Meta's Llama, you can download it onto your machine. It's self-contained, and then you can use it. At the end of the day, I'm going back to number 3 again. Never, ever, 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 ever enter sensitive, proprietary, or patient identifiable data into any general purpose LLM. As we close, we are building AI ready teams. That's the goal over this 12 weeks. We're not just chasing hype. So what you can do is you can download the clear prompting worksheet. The link is down below. But most importantly, please subscribe and hit the bell so that you don't miss next week's session on summarization when we're going to start to tackle all that data overload. All right, I'm Tracy Yonkin. Let's lead this change together, and I'll catch you guys here again next week on the flip side.